Hi, my name is Rivka Kushner, and I work at CATIE on the Hepatitis C team. Recently, I had the privilege of attending the 2021 Virtual International Conference on Health and Hepatitis Care in Substance Users. This conference discussed emerging trends, promising practices, new research, and what's needed to support the health of people who use drugs around the world. Here are a few key themes and takeaways. An overarching theme of the conference related to drug policy and the harms and stigma that result from the criminalization of drugs. Criminalization is the ultimate form of structural stigma, and many speakers at the conference called for the decriminalization of drugs. Alison Ritter from Australia offered a pathway to creating policy change. She suggested that it is necessary to be part of defining what the problem is that policies are created to address. For example, policies around drug use can be focused on reducing the availability of drugs, and solutions are typically a law enforcement-focused response. Alternatively, the problem could be defined as the potential harms from using drugs and the marginalization caused by stigma and criminalization. The policy solution here would look very different. Conference attendees were challenged to consider their roles as policy entrepreneurs, to seek out windows of opportunity, and to influence both how problems are defined and which solutions are matched to them. Social and structural determinants of health, which can also be thought of as structural drivers of health inequities or harms, are created and reinforced through government and institutional policies. The crises of drug poisoning deaths, hepatitis C, HIV, widening wealth inequities, lack of affordable housing, lack of adequate income assistance, racism, and the like are rooted in government policies that insufficiently address or exacerbate these issues. Here's just one example: the lack of access to and availability of affordable housing, which creates housing instability, including homelessness. We heard over and over how people who are experiencing homelessness have higher risks of hepatitis C, HIV, and overdose. Only focusing on hepatitis C or any one health issue is always going to be inadequate. The health and well-being of people who use drugs is at its core an issue of social justice, and this cause should be linked with broader social justice movements in efforts to change policies. We are still in a global pandemic, and it's been a very challenging time. When it comes to hepatitis C and harm reduction services, at varying times, people have experienced reduced access to these essential services. In North America, entirely preventable deaths due to the drug poisoning crisis, which is sometimes referred to as the overdose crisis, have increased during the duration of the pandemic. There have also been a few innovations that have resulted from these challenging times. During the pandemic, 47 countries expanded capacities for providing longer periods for take-home doses of opioid agonist treatment, which is sometimes called carries as opposed to witness doses. And Canada was among those countries. This is a change that people who use drugs have been advocating for a long time. And these kinds of reduced demands on people receiving opioid agonist treatment had an overall positive impact on outcomes. Programs around the world continue to offer and expand access to low-barrier hepatitis C prevention, testing, and treatment services. Here are a few common features that help to meet people where they're at while offering high-quality care. The first feature is a rapid expansion of telemedicine, virtual care, and phone consultation, including accessing specialist care from a community service with support to make that virtual connection through a nurse or outreach worker. Another feature is co-location or integration of hepatitis C harm reduction and health services, for example, at needle and syringe programs, supervised consumption sites, outreach teams doing primary care, or with enhanced pharmacy support. Offering same-day testing and linkage to care, and even treatment initiation, which was made possible through access to simplified hepatitis C technologies, including point-of-care RNA testing. Nurse-led models of care that deliver integrated and decentralized services. And finally, people with lived and living experience, developing, leading, and supporting programs and services such as mobile clinics, culturally adapted education and screening, and peer outreach, case management, and support work. The final theme is the urgent need for rapid expansion of harm reduction services globally. There is concern that within efforts to eliminate hepatitis C, harm reduction is being made invisible by hepatitis C treatment. Carrie Fowley from Australia asked, "We know about treatment as prevention, but what about prevention as prevention?" Efforts to eliminate hepatitis C within the prison system capture this contradiction, with many examples of increased access to testing, linkage to care, and treatment for hepatitis C, but without giving people the tools they need to prevent new infections. There have been very limited increases in access to supervised consumption sites and needle and syringe programs within the prison system. And in some places, access to opioid agonist treatment remains a challenge. Questioning why so many people in prison have hepatitis C to start with comes back to the policy issue at large of criminalizing people who use drugs. When it comes to supervised consumption service access, Canada leads the way, with about 1/3 of total supervised consumption sites around the world located here. But Canada's advances in harm reduction have been hard-won. They are the result of tireless advocacy from people who use drugs. And increases in harm reduction service access in different parts of Canada have been driven by policy windows that have emerged from an ongoing crisis, with thousands of people dying from entirely preventable drug poisoning deaths. Significant changes have been made, but the drug poisoning crisis continues today due to a continued failure of drug policies. There are many lessons to be learned from Canada, and preparing for fentanyl and other synthetic drugs to enter the drug supply of other countries should be at the top of the list. Thank you for watching this video. This video is a collaboration between CATIE and the International Network on Health and Hepatitis in Substance Users. To visit their website, go to insu.org. I'm Rivka Kushner, and I work at CATIE on the hepatitis C team. To learn more about CATIE, visit our website at catie.ca.